And welcome back. Dave Sussman here for Real Side Radio, hour number 3 on this beautiful Wednesday night. Across the fruited plain, you can find us at the Salem Radio and GCN Radio Network, 70 radio stations. Plus, you can find us on all of your satellite radio stations and therealside.com. If you have any questions for us in this final third hour, we're going to be talking COVID-19 and what is going on in reality, not what we're hearing from our mainstream media, but you can always give us a phone call at 855-732-5563. And of course, you can find me online at Whiskey Politics. Dave Sussman Show. Whiskey Politics is on all of your platforms, including YouTube, Apple Podcast, heck, all of your podcasts, including Google Play, as well as at the Ricochet Network. So I'm delighted this third hour to have our guest, somebody that really knows what is going on behind the scenes, you know, to filter through the muck of what we're hearing with its just continual changing news every single day regarding COVID-19, the impact that it's having. Simone Gold, she is an MD and a JD. Yes, she's a doctor and a lawyer. We're not going to hold that against her. She is an attending emergency physician managing a busy inner city emergency department with 150 patients daily. She doesn't want to say which hospital that is, and I completely understand why, but she's going to give us some insight as far as what is going on. Welcome, Simone. How are you?
Thank you so much, Dave. I'm happy to be here.
So, Simone, you are obviously of a level of intelligence that we will not see in our mainstream media, being both an MD and a JD included. According to the numbers right now, we're looking at 73,591 dead in just the United States. Does that number surprise you based upon the trajectory that we've seen just the past month?
No, I always thought this was going to be somewhat like an influenza. And a year and a half ago, influenza took 60,000 people. Some years it takes 40,000, some years around 60,000. And except I don't like to use the overall number. I realize that's the number that the media likes to do. They like to say 73,000 or 75,000. But I think that loses sight of the fact that this is really a disease of patients with pre-existing conditions, and even more so, nursing home patients.
Yeah, that's the report.
I could go on, but I'll wait for your question.
No, but that's a really important point. It's a very large percentage of the deaths in New York and other states, Washington State, where this started, are nursing home patients. Is that just due to the confluence of people being jammed in together, or is there just something inherently wrong with the systems of healthcare in those facilities?
So it's a combination of being older, which decreases your immune system a bit, having pre-existing conditions, which is what got you into the nursing home, because you can't just be in a nursing home when you're older. You have to have a skilled nursing need. So you have to have some underlying pretty serious medical condition. And the third piece is that there are medical workers that go back and forth from room to room, and I'm absolutely not blaming them. But this is how diseases get transmitted. In fact, this is how microorganisms were discovered a few hundred years ago. So they discovered that certain patients that were being treated by certain physicians, let's say, had a higher percentage of dying, for example, and they didn't know why, right? We didn't know anything about microorganisms back then, and that's actually how they discovered that there must have been microscopic beings that were going along with the healthcare staff from room to room. So this is very old medicine. It was completely predictable that this disease would fly through nursing homes. And one of my problems with the narrative that we're hearing is that by the focus on the overall number and the focus on quarantining everybody, we have acted very unethically towards our elderly in the nursing home. The resources should have been devoted to the people who really needed it, not the general population at large.
So when we see that there is, and we're going to have a break here in just a minute or so, but I want to carry you through because there's a lot of topics in all of this I really want to cover with you. But when we see that you've got governors like Cuomo and Newsom that are talking about the fact that lockdown orders should still be taking place universally across the board, as an emergency room attending physician, do you think that is necessary, or should it be more focused like to areas where nursing homes or people that are more vulnerable are living?
Hands down the ladder. I'm now coming out more strongly than ever because I think it's incredibly unethical that when you have limited resources, and no matter who you are, there's limited resources in this world, that those limited resources should be spread out diffusely amongst the general population instead of where we really, really need them. And I see every single day nursing home patients that do badly, and every single day healthier, younger people or middle-aged people that don't do badly, either have no symptoms whatsoever or recover just fine.
And yet we're in our last minute here before our first break, yet we're still seeing breakouts happening, or outbreaks, I should say, happening. We see them in Georgia right now and other places that are now starting to open up. Does that concern you?
So I expected the numbers to go up, both because there's more testing simultaneously, right? With Georgia opening up, the testing really just got more robust in the last, couple of weeks. That's part of it. And the second part, we don't have all the data, but it's not at all clear that overall social distancing is going to make a huge impact. In other words, the Sweden model, for example, if your listeners don't know, Sweden's more open.
Yeah.
They believe, their epidemiologists believe, that we're delaying our problems, right? That we're, they're taking it more a little bit up front, and it'll play out. So we just have to wait for the data, but I'm not surprised that the numbers went up in Georgia. I see high numbers still, even in my emergency department in California, but I don't see a lot of people getting sick and dying. That's overwhelmingly a disease of people who have pre-existing conditions, overwhelmingly.
Right. Well, let's talk about this after the break because I'm fascinated by your perspective on things. We've got Dr. Simone Gold. She is an MD and a JD, too, and we're going to be talking about everything that is COVID-19, the outbreaks, the shutdowns, lockdowns, and are they all necessary? After the break, Dave Sussman here at Real Side Radio. We'll be right back after the break, folks. Don't go away. And Dave Sussman in the chair here at Real Side Radio. You can find us at therealside.com. And if you have, you got something that you want to say, you can always get on the phone. You remember that old thing that we used to use back in the day? 855-732-5563. And you can find me at Whiskey Politics on all platforms, including Ricochet, YouTube, Facebook, Apple Podcasts, Google Play, and the like. Just type in Whiskey Politics and hit subscribe, and that way you don't miss any of our episodes. I'm delighted to be speaking right now with somebody that really knows firsthand of what is going on, because if you watch the news, I got to say that my faith in journalism today, it was low before all of this, but the way that just the prognostications and the predictions are all over the place. And one day you can do this and the next day you have to do that. And they're all standing there with their stupid face masks on, even though there's nobody standing around them on their local media. It just drives me crazy. So I'm delighted to have with us Dr. Simone Gold. She is a attending emergency room physician. She manages a busy inner city emergency department with 150 patients per day. She's giving us the insight to the real news with what is going on. Welcome back, Simone. How are you?
Hey, great.
Good.
So I wanted to tell you that something separate from the disease itself, I just got notified at our hospital today that they're letting 16 ER techs go, because the volume is so low in the emergency department and throughout the hospital that they're actually furloughing or laying off unless the business picks up. I'm not sure everybody realizes that hospitals are quite empty. The census in my hospital is about 50%.
So you're in an inner city hospital, and you're saying that just today they furloughed 16 emergency room attending physicians?
No. Technicians.
Oh,
So
technicians.
Technicians.
Okay,
Like
but the point being,
the nurses.
yeah, but the point being is that there's just no crowds there. They're not getting people coming through. Is that what this is?
Yes, so the nurses have had to take about a third of their hours off. We've taken about 25% of our hours off, and now I found out that the ER techs meant almost about a third of them are being laid off, which is incredible.
So this is I don't know which I don't know which hospital you are at, or we can't say, but I do know of two other hospitals in Los Angeles area. I've got two friends. One is down in Torrance and the other is in the San Fernando Valley. And one of them is also an emergency room attending physician, and he tells me that he is seriously worried about his own job. There's just nobody coming through. okay, we were supposed to be deluged. They've got the USS Mercy, off of San Pedro Harbor for overflow. What happened?
Okay, so we had meeting after meeting after meeting how we were going to handle this huge overflow. And I kept my thoughts to myself. I'd never thought it was going to be that bad. But we set up a huge tent and we set up the whole section for the patients. And let me tell you, there was no flood. There was no flood. And then about 2 weeks ago, they sent out an email saying, well, we're just going to close that big tent area. And there was no big discussion, and there was no big consideration of the process that we went through. Was this a good way to spend our time and our money, right? There was just no thought into it. So we just, we're twiddling our thumbs. That's the truth. We have about 50% census, and I will tell you that in 1 week, the doctors too, our hours were diminished by about a third. So, come in one day and you just discover that. It's pretty challenging, and I just want to make sure people understand that.
Let's go back to what we were just talking about before the commercial break, because one of the most interesting case studies, I think, out of all of this is going to be the country of Sweden. Now, you mentioned that Sweden did not implement complete lockdown. They had open restaurants and stores and places for people to congregate. They were saying to people, look, keep your social distance, use your common sense, but we're not stopping businesses here. And the last numbers that I just saw is that I think Sweden itself per capita has like the fourth or the fifth lowest number of deaths due to COVID in all of Europe. Is that what you understand as well?
That is correct. That is correct. Let me be clear that forcing someone to lock down, as many governors are doing, versus asking people to comply with things that make sense that you explain to them are two very, very different matters. It is not as though Sweden acted irresponsibly. The leaders in Sweden asked their citizens to do a few things. Keep a bit of social distance, don't go out as much. They did do things. They did, but it was voluntary. It's an entirely different story than what we've going on in some of our states right now.
So when you see that a business owner, she has a hair salon in Dallas, Texas, is now been essentially sentenced to 7 days in jail and $7,000 in fine because she's just trying to feed her kids, and the judge slams the door on her. They're letting people out of jail, including pedophiles, murderers, and rapists, because they're concerned about COVID, and they're sticking people like this Dallas hair salon owner in jail for 7 days. Have we just lost our minds here, Simone?
Well, I've never gone public before. I've been so motivated to go public just in the last month because I'm so concerned about the legal crisis that's facing our country. We're all acting as though there's a huge medical crisis. There's a medical issue. We should handle it responsibly. But what's going on in our country now is a terrible legal crisis. Our constitutional rights are being trampled on right and left. If you had said to me a few months ago there would ever be a situation where the government can tell you that you can't go to work, I would have laughed. It is absolutely unconstitutional. What the case you're referring to, the Texas judge, I find so much of this unconstitutional, and I think it's very important that these are cases that wind their way through the Supreme Court, up all the way up to the Supreme Court, and have this question settled, because we know that another medical issue will come along, and we really might lose our constitutional rights for good.
Are you surprised, as I am, that people are so... We've got a minute left here, so we'll have to carry this through the next break. But real quickly, I guess this is more of a statement than anything. I'm stunned at how easily people can be manipulated to give up their constitutional rights. And it's terrifying to me because, let's face it, this is awful, but this isn't a war of World War III. This is not a terrorist attack. It is a medical situation. And the fact that people are giving up their constitutional rights to work, to have free speech. In the last segment here, we were talking about how Facebook has 20 supreme, members, essentially most of them are extreme leftists, that are going to determine what you can and can't say on Facebook now. I mean, this is just downright scary. We've got Simone Gold. She is a doctor, and she is also a lawyer, and she is a attending emergency physician at a major inner city emergency department hospital with 150 patients a day. Stick through this, folks. We've got a lot more to cover about your rights and COVID-19. We'll be right back here. Dave Sussman at Real Side Radio. Sussman here with a White Man Overbite. We got the best bumper music in all of radio. Happy to be here with you at Real Side Radio on a beautiful Wednesday night. You can find me at Whiskey Politics and all of your platforms. Please connect with us over at Facebook. You can like our page as well as on, the Instagrams and YouTube. Please subscribe, and you can follow me at David Sussman on Twitter as well. We're talking COVID-19 and how it is just essentially created just the insanity of people giving up their rights so easily right now. It's one of the biggest frustrations that I think we are seeing through this entire chapter. And there's no better person to talk about this than somebody that's on the front lines, an attending physician at a major inner city hospital with over 150 patients per day, Dr. Simone Gold.
Whiskey Politics and all of your platforms.
Simone, how are you?
Facebook. Great. You can like our page.
Great. We're gonna need to have you turn down the background, the computer, because I'm getting feedback. Can you hear me?
Can you hear me? So
yes.
On Twitter as well.
We're getting a little bit of we're getting a little bit of cross back here, Simone. Real quickly, hopefully we can fix this on our end. If you've got any noise on your end, you can turn that down. But there was this. I want to talk with you about another doctor that was he went viral. Him and his partner had an emergency, an urgent care in Bakersfield, and the local NBC news station interviewed them, and I know that we're still getting a lot of feedback here. I'm going to take my earphones off, Cody. And what we heard was that this went on for about an hour, Simone, where the two doctors were talking about their opinion of the fact how the lockdown is not necessary, and that if you extrapolate the number of people that are out there truly based upon the people that have been tested right now, that the per capita number of people that died in the state of California is 0.03%. Facebook and YouTube have in the last couple of days taken down this video that went viral of two doctors calling out the experts about what the real numbers are. What were your thoughts on all of that?
About the doctors in Bakersfield, yes?
Yes.
I was very, very upset about that. At the end of the day, if you looked at their video, they were just reporting their own data. And I thought you can choose to believe or not believe. You can judge the credibility for yourself. That's the beauty of our country. But they were actually deplatformed, meaning that you could no longer watch them on YouTube or Facebook. And my problem with that is that YouTube and Facebook have become the de facto town square. That is where we go to for our information. And when a big corporation takes you off, you no longer have the right to free speech. I was very, very distressed by that.
It's really scary. In the second hour tonight, I was talking about the fact that Facebook is implementing this 20-member panel that's going to determine whether or not, if you appeal being kicked off of Facebook, they will determine whether you can get back on. And it's full of leftists and Soros types. And I mean, it's really a rogues gallery of a hardcore progressive, ACLU types and leftists that are out there. So our tech titans are in essence determining what you and I and other just normal people are hearing, and they are controlling the news. As a doctor, however, based upon what Dr. Erickson was saying, how herd immunity, and if we take the extrapolated numbers based upon the tests that have already taken place, that between herd immunity and the fact that this thing is it's hurting the vulnerable, of course, but 0.03%, was that a number that you would agree with?
I would agree with that number. I wouldn't have phrased it that way because, again, I think it's more meaningful to understand how you are in your location or your age group or your situation. In terms of herd immunity, I want your listeners to know that in the Bronx in New York, where it's the epicenter, you can find these numbers on the CDC. 45% or so of people that live in the Bronx have tested positive when they extrapolate the numbers back from the antibody testing, which means either social distancing doesn't work or the virus is out there longer or it's just more contagious and doesn't make you that ill. The point is that we don't have all the data, but what we do have suggests that it's out there and it's a lot more mild than we think.
So what is it that we think is happening here? Because when I hear a doctor like you very accomplished, very highly educated, Chicago Medical School and Stanford University. I mean, you're obviously a brilliant individual. Somebody like you is saying things that the government, the officials, and the media will not allow to now be promulgated out into the marketplace of ideas, because what? You're going against their groupthink? And if you are, why is it that they are so locked in this one way of thinking where they're going to throw people in jail for opening up their hair salon?
I think everybody has to, in every generation, fight for their constitutional rights. That's the bottom line. We have a right to free speech. This is why we're a special nation. Europe, for example, does not have the right to free speech. We're one of the last places on earth that has that right, and if we don't fight for it, we're going to lose it. That's what's happening.
What do you see? I'm not going to ask you to prognosticate, but let's play a little bit here of prediction theater, okay? They're talking about second waves. They're talking about the fall coming around and people are going to get sick again. They're talking about open up too soon at your own peril. What do you think is going to happen over the next 6 to 12 months with this?
I think if this hadn't been such a huge news story, this would have just been an accepted kind of medical situation. I want to call your attention to the fact, something that you have probably forgotten or never learned. There is a large epidemic in our country in 1968. It was news, but it wasn't news that took over the country.
Hong Kong flu.
And that's it. The Hong Kong flu. It took out 100,000 Americans, which is equivalent to 200 to 250,000 Americans. The government didn't shut down. The businesses didn't shut down. Universities didn't shut down. You went on with your life. If you
they had Woodstock in the middle of it.
They had Woodstock, and if you ask somebody who's 70 years old, they will tell you that what they would do is they'd wash a little more, they'd wipe their counters a little more, and that's how it was. And people should look that up. This is not the first time human beings are going to face a virus. It's not the last time. So do I think there's a second wave? I think there's always viruses. Yes, so I do. But I'm not sure that it's front page news or that we need to lock down our country. In fact, I'm sure that we shouldn't.
Right. But the idea that this particular strain of COVID, this particular strain of flu, if you want to call it a flu, is so much more easy, obviously, to give it to somebody else. It's you know, and that's the problem with it. They were saying that, you know, at the beginning, you know, while Trump was closing down the travel, from China, and he was being called a xenophobe and a racist, you had Bill de Blasio in New York telling people to go out. You had Nancy Pelosi telling people to go out to Chinatown. This was in February. You had even Dr. Fauci in February telling people that they shouldn't be worried if they go on a cruise. So why is it's changed so quickly and so much day to day? Why is it that people, do you think, are still just kind of blindly going with the scientists and the leadership and the government right now when they really, it sounds to me like they have no idea what the heck is going on?
I do find it distressing that the narrative always changes and pushes our freedoms and our constitutional rights back further and further and further. When there's a piece of good news is right when we're told there's a second wave. It's very easy to control people if you saddle them with fear. That's really the easiest way to control somebody. And the only thing more important than freedom to most people is their life itself. And I think that we're putting people in a position between choosing between their own life, or what they think is their own life, and freedom. And we have to make them understand this is a virus. There's lots of viruses. It is very contagious. Don't misunderstand me.
Yeah.
But it's not lethal the way it's being portrayed. It is highly lethal to nursing home patients and to patients who have diabetes, heart disease, lung disease. There's no question. You don't want to get really sick.
Dr. Gold, we're coming into our last break here. Tell us, everybody, where they can find you, your writings, and anywhere else, anything else that you have up there.
Thank you so much. I like to write on the intersection of medical and legal issues. So you can find me at the Gold Opinion. Gold, as in 14-karat gold, goldopinion.com. Thank you.
Thank you so much. I greatly appreciate it. And also, you're exhausted. I mean, you know, we emailed back and forth about you coming on. You've worked straight 4 or 5 days in a row. You're just done. So thank you so much for everything that you do. And really, you know, just from all Americans, obviously local people as well, for, you know, just bringing your common sense approach to this. Greatly appreciate you taking the time, and stay safe. And I'd love to speak with you more, and maybe we'll have you on my full-length interview show to discuss all of this in much greater detail when you come up for air. All right?
Thank you so much for inviting me.
Thank you so much, Dr. Gold. You can, and again, the Gold, I'm sorry, real quickly again, thegoldopinion.com, thegoldopinion.com. Thank you so much. We'll be right back with my final segment here for the night. Dave Sussman here at Real Side Radio. Don't go away, folks.